Hey,
Did you hear?
Did you hear about the new podcast?
Hoy,
What's it called? It's literally called Psst. What?
there's a new
There's
podcast
a
out
new
right now.
podcast?
It's from Filcha.
Filipinx AO sharing stories together, as in the Psst podcast.
Welcome to another episode of the Filipinx Sharing Stories podcast. Today is September 26, 2021. This is episode 11, COVID-19 effects on the Fil-Am Biracial Multiracial Community. So disclaimer, information is up to date as of today's recording live stream on September 26, 2021, but due to certain circumstances surrounding COVID-19, information may have changed by the time you view this episode. We would also like to acknowledge our presence on Indigenous lands, which we stand on today. We express our gratitude and appreciation to those whose territory we reside on, and we honor the Indigenous peoples who have been living and working on this land since time immemorial. It is important to understand the long-standing history that has brought us to reside on this land and to seek to understand our place within that history. We have closed captions on Zoom and Facebook. We have posted instructions in the chat comments. So welcome today. I'm going to pass this on to our internal host, Andrea.
What's good, y'all? Hi, mayon hapon sa tanong. Sorry, Mom, if I butchered that. I'm Andrea Mackey, and I'm your she, her, hers, and I'm your podcast host within Filcha. And this podcast is made in part thanks to the Filipinx AO Community Health Association, Filcha, which you might have heard as, Filipinx AO COVID-19 Resource and Response Team, PhilCOVID. So our goal today is to address, health disparities within the Fil-Am community and provide policy recommendations and any resources surrounding the needs of our communities. And so we aspire to serve as a network for the Filipinx AO community through collaboration between Filipinx AO scholars, community organizers, leaders, researchers, social workers, public health advocates, and other professionals, clinicians, and media. Like today, I'm very honored to have, Asia and Arvin on. We bring a wealth of different, perspectives to this topic. And I'm coming to you today from Tongva Land, so based here in LA. And I'm just to give a little bit background about myself. I'm a community organizer with Kabataan Makabayan Pro People Youth and a Peter Harbridge Policy Fellow with the California Pan-Ethnic Health Network. Mobilizing our communities of color, pushing to advocate for policies that advance health and health equity. And so a lot of my commitment in eliminating health disparities and underrepresentation research is really rooted in my experience being a mixed Filipina Scottish American. And so I'll pass it back to Arvin to share a little bit more about him.
Yeah, my name is Arvin, he, him pronouns. Right now, I would like to describe myself as I guess, organizer, grassroots, and nonprofit. So currently I am the statewide campaign manager at Californians for Justice, but I also have done a lot of grassroots work with Malaya, Filipino Advocates for Justice, and a lot of other community organizations as well, as including like Antipasa too. But yeah, enough about me. Grew up around the East Bay and stuff. I'd like to introduce our guest for today. On TV, you've seen her on Modern Family, The Young and Restless, Speechless, Superstore, Alone Together, Lifetime TV movie Stalked by a Reality TV Star, and most recently, Blumhouse's Nocturne on Amazon Prime. She also has a YouTube channel where she uploads engaging and educational content about fashion, beauty, and self-care. She as well created the global movement Magandang Morenex, which translates to beautiful brown skin to challenge colorism and celebrate the diversity of beauty in Filipino communities. Her work has been covered in numerous international publications such as Vogue, Time, CNN, NBC, Elle, Glamour, and more. She is also an actress, content creator, activist, and founder of Skinfluencer, a digital media platform that explores beauty and fashion at the intersection of race, identity, and culture. I'd like to welcome Asia Jackson.
Hi, everyone. Thank you so much for having me. I'm really excited to have this conversation.
Great to have you here today, making time to have this important conversation that we're going to have today. So I'm going to pass it back to Andrea for a little message by our sponsors.
Yeah. Asia, is there anything you'd like to add? I know that's a pretty extensive introduction, but okay.
No notes.
Okay. And so before we begin, I like to take a minute for some acknowledgements. A big thank you to the Association of Asian Pacific Community Health Organizations, APACHO, for making all of this possible. This podcast is also partially funded with generous support from the Walmart Foundation and produced in partnership with We Can Do This and the Department of Health and Human Services. And so we're talking today about COVID-19 effects on our Filipinx, biracial, multiracial community. This is our 11th episode of Filipinx sharing stories together surrounding COVID-19 following our pilot episode. And so this follows up on our episode 10, the COVID-19 effects of Filipino XAO adolescents and young adults. Great episode. Check it out if you haven't seen it already. And so this episode is really going to address the impact that COVID-19 had on our Filipinx, biracial, multiracial community through our personal stories, sharing our experiences, and our podcast wants to be the safe space for our community. So we hope to give all members within the Filipinx XAO community a voice to acknowledge the different experiences, all of us face. And so throughout the episode, if you have any questions, please put it in the chat, in the Facebook live stream. We'll be sure to try to address those throughout the conversation. So to get us started, we're gonna jump right into it. So we're talking about, biracial, multiracial communities. And so it's interesting, the US Census just came out, there's a 276% increase of the multiracial population. On the CDC, you see these statistics for COVID, but I feel like it doesn't really capture, what it means to be mixed. And so, we have all this data, but, who is a part of this data? And so, Asia, I think this will be, great to really hear from you and based on your personal experience, how has COVID-19 affected biracial, multiracial communities different than other communities?
I mean, I can only speak from my own personal experience. And so one of the ways that it's affected me personally is, we know the effects that COVID has had on both Filipino communities and communities of other colors. So the Black community as well. And, my mom has had so many friends who are nurses that were lost due to COVID-19, really at the beginning of the pandemic. I've also had some family members that were hospitalized because of COVID-19. So all around it was just really difficult. At the beginning of the pandemic, my mom got stuck in the Philippines. She was supposed to come back in March, but then the pandemic hit. So she got stuck there until October. And it was difficult for me because I was living alone. I couldn't really see my dad because, I wanted a social distance. So it was just really hard to know that my mom was in the Philippines with, really no like healthcare or like no support. I mean, obviously she was with her family and she had a lot of support in that regard, but it was just it was a really difficult year last year. I'm just going to be completely honest, just as a biracial person, but just as a human being too. It was just, there was a lot of stuff going on, a lot of family in the hospital, a lot of people that we know who, work in healthcare that we lost. And it was a lot.
Yeah. And I totally resonate with that. I feel like we all, like to acknowledge, the ancestors that we have, past, present, and future, just because, we've lost so many things, like you mentioned, loss of space, loss of experiences, spaces. And so it's really made us reflect, in public health, I feel like there's a dehumanization, because it's constantly the numbers, the data. So yeah, it's, I'm glad you're sharing, your experiences here. And so Arvin, how is this resonating with you?
Yeah. Speaking of experiences too, I know the pandemic has only brought out, one like mental health with folks as well. Just being able to like think about all the things that went on during the pandemic too, with people sitting at home, especially with last summer, there was a huge movement with Black Lives Matter and resurgence during the pandemic as well. And also this year with a lot of anti-Asian like violence that kind of like started popping up too. So Asia, this is kind of like speaking, since you are like a content creator as well, who spotlights different issues and stuff. And also with like all the narratives that are being built online about like the movements and stuff. So speak on your experience, like how do you feel about like a lot of like the narratives of pitting, the Black community, the Asian community against each other at this time too, when, we exist in like a system of white supremacy and stuff. So how do we, this is a hard question too, because this is all like, we're trying to figure it out too, but how do we control that narrative and make sure we stay like unified at this time too? But yeah, I know it's a lot.
Yeah. I'm glad that you brought up like Black Lives Matter and Stop Asian Hate, because as a Black Asian person, I was also affected a lot by those movements as well. When it comes to Black Lives Matter, I remember hearing about it for the first time when I think I was like 19, or yeah, I think it was like 2013 or 2014 when I first heard about it. The protests were going on in oh my gosh, where was that? It was with Michael Brown. I forgot which. Oh my gosh, I forgot which city it was in. But those were, I was really inspired by the activists that were doing really great work on the ground, and it really inspired me. It really awakened me in a way to a lot of like I didn't realize, I guess, when I was a teenager how deeply rooted white supremacy was in this country. It was not something that I really knew as a teenager. And so seeing those protests and like living through it, it really awakened me in a way. And so, when it came up again last year with the murder of George Floyd, it was something that I really wanted to talk about. I wanted to talk about, the experiences that I have personally had with police. I wanted to talk about the experience my father had with the police when he was younger, when he was a teenager, because he also grew up in Carson, California. So he was in the SoCal area. And, I really wanted people to understand why people were so upset, because, for people who aren't part of the Black community, they probably just don't get it. You know what I mean? Like the Black experience is so specific. There's a lot of specificity and nuance in Black experiences. And I really wanted to share, because, my audience is a mix of different people. I have Black people following me, Asians, Latinos, Indigenous people. It's like a big, it's like a nice mix of people. And so whenever I speak on my own personal experiences, my goal is really to just provide a perspective that people probably haven't heard or probably haven't seen before. And I did a lot of work trying to bring these communities together, because there were so many forces trying to push Black and Asian communities apart, with the hate crimes that were happening in Chinatown and Oakland and just like all of this crazy stuff. It was just like both sides were just kind of clashing and going at it. And I was like, yo, this is not what we need to be doing right now. This is not the point. And so for example, I created a whole like infographic post about like the model minority myth. And, I really wanted to share a lot of experiences about what it's like to be a Black person, to be a biracial Black person, to be a biracial Asian person. I kind of wanted to share stories like that to kind of bring both communities together. Trying to bring these two communities together is a really huge part of the work that I do. As a Black Asian person, I want Black Asians to be recognized by both groups so that we can help bridge communities together. And I've done work like that in the past, but everything that happened last year just solidified it for me. I was like, okay, yeah, this is my purpose. Like, this is what I was meant to do. You know, I'm a good person, I think, to make this part of my platform. And so, yeah, that's kind of what it was like as a Black Asian person anyway. I'm glad you brought that up though.
Yeah, it's like, it's still even in like an ongoing thing too, like how a lot of like Asians too as well, like definitely need to address like, anti-Blackness and stuff going on too that, as a community that we need to like do internally as well. So it's interesting, like you get to experience both like experiences too in a certain perspective as well. So yeah, write a lot of dope stuff about that. But let's segue to our next question a little bit. But yeah, pass it back to Andrea for a little to more talk about other things.
Yeah, I mean, definitely resonate with that. I mean, like even in like the community organizing space, there are certain, I feel like older generations where they would talk about like when like Stop Asian Hate was happening, really trying to bring in the police into this, even though we know that state sanctioned violence is very much going to be targeting a specific community, the Black community. So
and one thing that I want to add to that also is that I don't think a lot of people in the Asian community realize how it would affect the Asian community as well, because I know here in Los Angeles anyway, I grew up on the east side of Long Beach. There are a lot of Southeast Asians, like brown Southeast Asians and Pacific Islanders, that are also targeted by police. Jails and juvenile detention centers, prisons here in California, they're packed with brown Southeast Asian Pacific Islanders. So that's something that I always wanted to bring up as well, because I think a lot of the Asian community that aren't familiar with other like disparities within ethnic groups, they're not aware of that.
Whoa, that's a big one. I'm glad you brought that up, because I mean, this also ties in with like a lot of your work with colorism as well, and within like also like the Asian community too. When we hear Asian, you usually only hear like most people outside the community usually think East Asian too, and Southeast Asians like experience a lot of that violence as well, but not the same extent too. But I think under the system, it's just we all exist in this like type of bubble of like varying degrees, but like also like it just messes us up. I was about to say a word. I stopped myself real quick, but it messes like all of us up at the end of the day too. It's the whole theory of like if the Black community isn't free, we're not all free. Black and Indigenous folks are not free, we're not all free. So yeah, speaking of the pandemic and like COVID, what that has done to like also like not just like us affect us physically, but like mentally and socially as a society, and speeding up these issues that just bubble up because of this. There's like a moment of like, what do we do like to heal ourselves, as a community, as people, because so many issues with the environment, social and global climate change, all that too. So how do we heal like spiritually, physically too? So pass it to Andrea to.
Yeah, that's interesting. You bring up specifically the word heal. So I've been working with this Filipina Chinese healer. And when you look up the word heal itself, if you look at the etymology, it means to be sound or whole. So like, I don't know, Asia, if you might have like thoughts on this, but not being, being mixed, we're not necessarily whole, but we are whole in this whole identity. So, what does healing look like to you in that sense?
I mean, I think that was really beautiful what she said, what you said. I think like healing to mean feeling whole. I think that's really beautiful, because I guess sometimes before you work on healing, you feel damaged in a way, fractionated. You feel like a fractionated human. You don't feel like a whole person. And so, when you bring that experience specifically to a biracial person, it's like doubled, you know what I mean? So I actually really like that. I think that was really great. But I don't know if this has anything to do with what we're talking about, but I just wanted to bring this up because I just love talking about her. But my great grandmother in the Philippines, she's Igorot, we're indigenous Filipino, and she was actually a healer over in Baguio. And so she, like, people would come to her all the time to, like, I don't know, she had like a healing ability. I'm agnostic, so like I don't necessarily believe in this stuff, but I don't know, there's just some people on the planet that just have some sort of thing going on, and we just all don't understand it. But people would go to her and she would just like heal everything that people came to her for. I don't know the science behind it, can't explain it, but I just thought that was an interesting thing to bring up.
There's a term for it, I forgot. But I've met like healers before too. But yeah. Shout out to my mom's from Baguio too. I was like, ooh, Baguio.
Oh, hey, work. Okay. Okay.
Yeah. So going back to healing.
Oh yeah. Going back to healing, how, this is an interesting question, and we've kind of brought it up, but when Arvin and I were looking at this question, we're like, I'm not sure. So, what has helped, the biracial, multiracial community recover through COVID-19?
I mean, for me personally, it was just connecting with both communities, just especially because of social distancing. Social media has been really helpful. I was able to connect with both Black and Asian, and specifically Filipino communities. I've never felt this connected to both communities before. So, as bad as the pandemic has been for me, it really, in a way, there's like a silver lining in that I was a lot closer to both communities. And so, yeah, for me, it's just connection. I think as humans, we all need that, but on a social construct level, you really need to connect with your community because they take care of each other and they understand certain struggles that perhaps you don't. And yeah, for me personally, that's what's been helping me.
Have you always felt, because it sounds like, you have this, you feel pretty confident in both aspects of your identity. Have you always felt this connected to?
No way. I had so many identity issues growing up. I felt so disconnected from both communities. I've lived in both communities. I've lived in predominantly Black neighborhoods. I've lived in Asia. And so I've never really felt like I was part of either community. But I think that when I got older, and living in Long Beach, I think helped because that's a very racially diverse city. And so it wasn't as big of a deal to people there that I was Black and Asian, because there were other Black and Asians there, and there were, Chinese and Mexicans there, and there were like Cambodians and Black people that, like, there was just like a lot of mixed people, but also just everyone was living together. So it wasn't as weird. But I think when I became an adult, when I got older, I just realized how accepted I have been by certain people in the community. And I think what I realized is that there is a very vocal minority in each community that said, you don't belong here. And that's what I listened to the most. I wasn't listening to, all the people that said, you are a part of this community, that accepted me the way that I was. And so I think when I got older, I just leaned into that a little bit. I've heard so many stories of Black and Asian kids, like their parents, like one side didn't accept the marriage or something like that. For me personally, both sides accepted. My dad's Black family accepted my Asian mom, and my Asian mom's family accepted my Black dad. There was literally no issues there. There was no fighting. And so I really feel blessed that I was able to grow up in two families that, really loved me as I was. And so Yeah, I think growing up, I just kind of got more comfortable in identifying the way that I was, because I wasn't sure how to identify when I was younger. I didn't know if I could call myself Black or if I could call myself Filipino. I remember this one specific conversation that I had with my brother. My brother is not mixed with Black. He is full Filipino. He's my half brother.
Mhm.
And I remember having this one conversation with him when I was like a teenager. I think I was like 19. And I was saying, oh yeah, the Igorots, I was talking about Igorots as like I wasn't a part of that community. And my brother looked at me and he said, why do you keep saying they? You're also Igorot. And I don't know, that just like really did something to me. I was like, wow, you're right. I literally am a part of this community. Like, this is who I am. My mother is Igorot. And so I think, having the support from my family when they say stuff like that, it really, really helped me. And I'm really grateful to have that experience personally.
Beautiful. Yeah. I feel like language is like one thing that's like very important of, I guess like how we talk about ourselves too. Because we're kind of like speaking like our own like existence of like what we think about ourselves. So I think that's like super powerful, and like just like one flip of like identifying with them instead of saying they and saying we, that's such a like a powerful thing that we don't think about. So
yeah, and you think it's like not going to be a big deal because it's just a switch of one word, but it's so powerful. It really made me feel like I was a part of the community. I don't know. It's interesting how language works that in that way.
Yeah, language is wild. Like just one word can like change your life. It's amazing.
Yeah. And it's also really unique because I feel like even within, like the Fil-Am community is just in and of itself, there is an identity crisis there too, to begin with, I remember, when you have to check a box for your SAT or all those like tests. I had identity crisis within, okay, well, is it, if I have to pick one, is it white? Is it Asian? And I didn't feel Asian. So I put Pacific Islander, which I was like, the Philippines, when I learned, oh yeah, they're islands in the Pacific. And then they changed something where it said Spanish origin for Hispanic. And I checked that one time, not realizing, because I'm like, oh, Spain was here. On top of, am I white today? Am I Asian today? So
yeah, I hate the other box. You should be able, I hate it when it's like check one and then like there's an other box, because like, why can't we just check two? Why can't we check more than one? Because to me, other is just like, what does that mean? Like on a statistical empirical level, like other. Okay, that could mean someone who is Asian and Latino, or it can mean like someone who's Black and white. Like it doesn't really mean anything. If you just check other, you should be able to check more than one so you get that specificity. But that's neither here nor there.
Yeah. I was like, why can't they just have like the fill in the blank too? Like you can do that with voting. No.
Exactly.
Yeah, the whole thing. I was just thinking about like other issues of like, oh, why don't we just disaggregate data as well? And then, that's another topic I don't want to touch today. But yeah.
It's so important, especially, talking about COVID-19 when, I didn't really read it out loud, but on the CDC's website, the category of multiple or other / non-Hispanic, they list out, the number of cases for COVID, the number of deaths. But who is that? Like, what does that mean at the end of the day? And then it just goes to show like race is such a social construct. And yet a lot of our medical system, I'm coming at this from a health perspective, largely bases a lot of things off of our race, even if, but what does that mean to a mixed person? When, so I used to do diabetes management and prevention. And so to get screened for prediabetes, if you're Asian, your BMI is assumed to be less, So if I identified as Asian for this one screening test, technically I have prediabetes based off my like weight, But then if I identify as white, I don't have prediabetes. So then there's like this disconnect on who's going to be getting resources or not, because
That is,
it's, yeah.
yeah, that's so interesting that you bring that up too, because I remember when I was younger, I've always been told, like, I've always heard this. It's like, if you're Black or Hispanic, you're at a higher risk of diabetes. And so I was like, oh my God, well, I'm Black, so I'm like at a higher risk for diabetes. But I thought it was like something genetic. I was like, oh my gosh, like this is a whole genetic thing. And then I realized after doing a lot of more research and, talking to actual people that work in the medical field, it's like a set of like socioeconomic issues that affects the data for specific races. It doesn't account for, people who live in certain like tax brackets or like where they live. And so I don't know. I thought that was really interesting when they just say like, oh, African Americans are at a higher risk, but they don't really unpack that, if you will. Like they don't really explain why that is, because to me, I thought it was like something genetic or something. So and then I realized, race is not biological, it's a social construct. But, I was like 17, so I didn't know all that.
Yeah. Yeah, I don't know why. I'm so disclaimer, I'm not in the health field whatsoever. But like I don't understand why like race is still used as like empirical, like, like, oh, if you're this race, you're more likely, like I don't why is this like still like 1700s, like,
Yeah. Yeah.
like yeah, Andre, you probably know more than me about that though. So
No, I mean, Asia, the fact that you had that conversation at 17, I feel like you kind of know it, but no one explicitly said it until like a few years ago to me. So, because it's racism, not race, at the end of the day, that creates all these differences in our health, and the differences we see on who's getting more affected by COVID-19, we definitely have all felt that loss, but, certain communities, we felt it more than others. Like, how many Zoom funerals do I have to be on nowadays versus, some of my white side of my family they don't believe in masks. So, it's an infringement on themselves. So it's interesting how, we are so confronted by this in this point in time.
I have a question for you, because I am not like in tune with medical community at all. My mom is an accountant, not a nurse, so it's the other Filipino stereotype. But I wanted to know if like, is there anyone in the medical community that is like working to like dismantle race or like take race away from certain statistics or something like that? I don't know how to word it, but like, is that something that some educators or like anyone that's working on that?
Yeah, Aaron, in our Zoom chat, just put this like new paper. There's actually been this discourse that's been happening in this one email thread that I'm on switching from looking at race. What does it mean to research race and really look at ethnicity? Our culture, and our language really does affect how we see the world. Oh yeah, there we go. Chandra Ford's book, Racism, Science and Tools, and APHA Press. So
thank you, Aaron. I'm going to be reading all of these. Thank you.
Yeah, there's definitely conversations, but it's not dominant. These are coming up in spaces, and they've definitely been talked about a lot, but it's not something you'll explicitly hear unless you really go looking for it. It's still on the outskirts, I feel. But I feel like there's a lot of people within Filcha and in other spaces who are working to dismantle those systems, because I know Bernie Arvin, and she'll be one of the podcast guest speakers later down the line, I think the next episode. But EGFR, estimated it's to measure kidney function essentially. There's this test, but the race of the patient can be grouped into Black or not Black, and they presume that Black folks have higher muscle mass on average, leading to higher kidney function, which means delayed screening and resources and prevention. And so a lot of this is also based on some this evolutionary byproduct of the slave trade, thinking that, oh, because folks had come across, they had higher levels of salt in their bodies to make it across the slave ships. And so some of our medicine is still utilizing these theories that have come about that have been explicitly disproven and discredited, but we're still seeing it exist. And so there's folks to push the medical community to move away from, utilizing race-based, medical treatment and screenings, but there's a lot of work to be done, because we think we have these conversations in education and we're starting to have these conversations in public health, but medicine is a big institution that has a lot to reckon with.
Yeah, it's just crazy how widespread and ingrained racism is in the whole structure of this country. I mean, a lot of people say that it's like not everything's about race, but I don't know, when you really look into it, it's almost like everything is when you really look into it.
Yeah. And it's like also like who's saying that too, when people say that, it's like, oh, it's, when you live in a system of white supremacy, a lot of the folks who benefit from that system don't have those experiences. So I mean, that's kind of like, oh, like I don't see it, and that's because you don't live through those lived experiences of what's going on. And
yeah, I'm like, you're on the outside looking in on my conversation, like, you don't really get it,
yeah, it's like that just stresses me out, just like thinking about like all the institutional things that like currently oppress us just come like rushing into my head. Just let me take a breather for that.
I know. And it's so like, I mean, I'm sure, like, I don't know if you guys have talked about this on this episode, or if, I mean, on this podcast, if it's been like a topic that came up in like previous episodes, but like it's so taxing on mental health to be aware of how many issues there are, not only in this country, but just in this world. And it's really frustrating. It makes me so angry, and it gives me a lot of anxiety, and it makes me want to like go into a depression. Like, it's just so much to acknowledge. It's almost like I just want to be ignorant to it. It was like, I'm being punished for knowing more. You know what I mean? Like, it's so weird. I hate it.
Yeah. I feel like just like being in, like, as someone who like works as an organizer as well, just like being aware of the issues and stuff, I'm just in a constant state of like existentialism of just like, like, do I want to know? Tame Impala is playing, do I really want to know? Like, yeah, no, I really feel that, Aisha.
Yeah, like when you lose sight of hope, that's when it just I start doom scrolling and spiraling. But someone, one of my mentors had like brought it up, this is love work, this is love of the reasons why we're critically conscious, or the way that, we do the work that we do is out of love. There's only so much, anger can fuel us, but, love can keep us going for a long time.
Wait, I love that. I love that so much. That really clicks something in me right now, because every time I do, like, having a platform and being visible is really difficult sometimes, because whenever you talk about something controversial, you get a lot of backlash sometimes. And it's really taxing on the mental health because you're just one person. But it's just really great to hear that, like, this is love work, because, it really brings me back to the reason why I wanted to talk about these issues in the first place. It's love for my community. And this is the reason why I talk about stuff like this. It isn't to, it's not hate work. I'm not doing this because I hate the people that I want to change or whatever. It's the love work. It's, I want my community to resonate. I want them to not feel alone. So I just really like that. I'm gonna remember that. I really like that.
Yeah, I feel that too. Like, I feel like a lot of stigma that comes from like, folks who just like talk about any type of issue too. I mean, especially I feel like you probably get that a lot too, of like understanding you know, like I'm not doing this to like purposely target someone. I'm doing this out of love for myself and love for the community too. I know one of the questions like that pop up in my head too, especially with you, Asia too. Like I know, I bet like some people come at you and you just need to like take a break. So like, what are like some like self-care practices that you do, like, you know, to like with that hate that comes into you? Like what do you do with, how do you respond with yourself, and where do you feel that energy like and respond to it and
Yeah,
help?
so it's like I need to like write like a paper or something to remind myself of what I need to do whenever I like am overwhelmed with stuff like this, because I think it would really help me. But one thing that I really like to do is I like to take a shower. I think water is so healing. I think that when you're just like in the shower, it's like only you are by yourself. No one is bothering you. You can think about anything you want because you're just there with yourself. Another thing that I like to do, obviously, is meditation. I think it really helps me center myself and, you know, keep these negative thoughts that comes from other people saying things to you. It really keeps them at bay, and you're really able to center yourself and be in tune with yourself and what you think about yourself. Um, Sometimes when stuff like this happens, I make an appointment with my therapist to talk through it. And a lot of a tip that I have actually for the biracial community is if you're mixed, I think it would be really helpful to find a therapist that is a similar mix as you. So my therapist, she's mixed with Black. She is Black and Persian. And so whenever I talk about, you know, trauma that I had growing up being like a mixed person and a mixed experience, she totally understood what I was talking about. Whereas, you know, if I talked to someone who wasn't mixed, they probably wouldn't have that firsthand experience. So I would say like try to find someone who is as close to your mix or ethnicity or race as possible. And yeah, and just take like turning my phone off. Now, sometimes I have to answer emails because like my work is like mostly online, but like uninstalling Twitter has helped me so much. Not checking my notifications, muting a thread that has gone viral, because whenever something goes viral, it always reaches outside of your own audience. And so people don't have the context, they don't know who you are. And so they don't understand what the conversation is even about. So muting that, like just really taking time to understand why I'm doing this work. And that's why I love that, you know, love work so much. Yeah, I think talking to your community, talking to your family, I think those are all really important.
Feel that definitely. I remember when you talked about getting a therapist that looks like you and has your experiences as well. I have like a story in college. Like I remember the first time I went to a therapist too. She was like this like older white woman, and I just tried telling her about like Filipino cultural norms and like traumas that have been affecting me. And she did not get it at all. It's like, and I was like, okay, I understand. I get it now. Like,
yeah. I have a friend who's Asian. She's a YouTuber. I'm not going to put her name on spot like that, but she went to a therapist, and it was a white woman therapist. And she was talking about the struggles that she has with her parents sometimes, because Asian parents sometimes can be really overbearing. And she was explaining that to her therapist, and her therapist was like, well, why don't you just not talk to them anymore? And she was like, that's not how it works in my culture. Like, that's just not how it works. You can't just like not talk to your parents. And so it's just really interesting how culture in even in the mental health industry or the community, like how cultural norms can affect the care that you're provided. I think that's really interesting. So she found another therapist who was Asian and understood that she can't just not talk to her parents.
that's great.
I'm glad y'all know how to that you can like kind of date therapists. You know, you can like shop around, because for a while I didn't know that you can. I felt awkward. I was like, you know, it's not really clicking. And it was only when I finally made the chance to like move on, that I was like, wow, you know, I don't feel drained after these conversations. I feel like I'm actually receiving something. So I'm glad y'all came into, you know, focusing on your mental health, being able to be like, no, this is not the good fit. I'm gonna move on. Knowing that, I think is powerful.
Yeah. You should never feel like, I mean, the work in therapy is not easy by any means. But you shouldn't feel like truly drained. You should feel drained and energized at the same time. You know what I mean? That's how I feel after a therapy session. You should never feel like you just talked to someone and you didn't receive anything in return. So that's what I kind of like to tell people when they're looking for therapists. But I do think that it's so great that as young people, specifically in like young people of color, we are seeking help. I think that's really cool. I see like therapy being talked about casually on Twitter and on Instagram, and I hear antidepressants being talked about casually like all over social media. So I think it's really great that young people are, you know, combating the stigma that our families probably have against, you know, mental health, and really taking initiative to take care of themselves. I think that's really awesome.
Yeah, that's so real. Like definitely when I see TikToks like about that, and it's just so normalized now. Like I kind of wish like I went to high school in this culture, you know?
I know, right? I know.
So amazing.
Yeah.
And I was just reading an article about how, you know, like the great resignation that's going on right now, about how a lot of younger folks as well are just quitting their jobs to like be present and just exist, because you know, like there's all these existential like things going on, climate change, you know, the US, everything that's going on, but they're just like being able to like discover themselves. I think that's super important. Today. Speaking of the community, I do want to like open up to like if anyone here wants to ask Asia or us any questions too, or watching on the live too. But otherwise, you know, we'll keep chopping it up. But yeah, I just want to remind folks too, we have 10 more minutes for today. So, Andrea, do you have anything?
Yeah, I know Asia, you just put out on Substack, your most recent article. You know, how's it been, you know, putting that out there? I'm getting very real about, you know, I am all of these things. I am Black and Asian and mixed.
You know, just like we talked about a little bit earlier, words are so important, and the changing of and, or the changing of or to and does a lot of work. It does a lot of something for a lot of mixed people. I'm not Black or Asian. I'm not Black or mixed, or I'm not Asian or mixed. I'm Black and Asian, and I'm also mixed. Like that is what I'm mixed with. And I think a lot of mixed people, just in my experience talking to other people growing up, you know, I am a military brat, so I've met a lot of mixed people in the military, you know, going to school and things like that. And we've all had an experience where we felt like we had to choose one or the other, or, you know, we just didn't really know how to identify. And to me, what is so powerful is switching that or to the and, because I'm not either or, I'm like both at the same time. So that's kind of what I wanted to write that art. That's one of the reasons why I wanted to write that article. But I also wanted to, and you know, I talk about this all the time on Twitter and Instagram. I just wanted to have it in like an article so that I could reference it at times. But I talk a lot about how my experiences as a Black Asian specifically are very different from people of other mixes. You know, my best friend is Chinese and Mexican. His experience are very, very different from mine. I mean, you know, as mixed people, we have that shared experience of not feeling this enough or not feeling that enough, but he's not Black. And so he doesn't know what it is like to be Black. And, you know, I have a lot of mixed friends from high school we all have very, very different experiences. So, you know, one of the biggest reasons why I wanted to write that article was to emphasize that, you know, even though we're mixed and we have this label, it is not our sole identity, because mixed isn't a race. You know, mixed race means you're a mix of races. And so you can't deny your mixes. You can't deny that you're Black or deny that you're Asian, because you're both at the same time. Mixed is not a race. And so I really wanted to emphasize that. I know that there's a lot of mixed people that follow me. And so I kind of wanted to write that for just every community that I'm a part of. Actually, there's like different parts in that article that are like targeted to different communities. But yeah, that's kind of like why I wanted to write that one.
No, I mean, it was powerful. Like, I really resonated with it, you know, being like that shift is incredibly powerful, because, you know, when you said, oh, I'm not this enough, like I feel that in the back of my head, like a lot. Like, you'll enter every space and then I don't even get recognized as, most people perceive me as Latina, you know, only or white, you know, depending on, you know, if I've been inside too much or not. And so, you know, I never feel like I should enter a space. And then I also have to check myself, you know, like being half white, you know, I have a lot more privilege than a lot of other people in the room if I enter a Phil-Am space, or and so it's like always awkward, but, you know, like kind of coming into that. But yeah, that is incredibly powerful. And I'm glad you wrote this, you know, that, you know, you're taking ownership over your own identity. You have that self-awareness versus the positionality that society tells us of where we are, who we must act as. So really resonated with that. Yeah, so I'm glad you put it into words. You're putting it out there.
Thank you. I really appreciate it. I was really scared to post it at first. Anytime I write anything about race or about culture, I'm always so scared to put it out there, because I know that, you know, you can't control the way that people interpret it or the way that people perceive it. And so anytime I put something out, like even when I did Magandang Morenix, like I was scared as hell to do that. But at the end of the day, it's love work. It's for our community. It's for people to not feel alone. It's for, you know, all that. So, you know, I just have to remind myself. We all have to remind ourselves that anytime we're doing any type of work like this, it's really important to know your purpose and come back to the reason why you do stuff like this.
Yeah, I have like a theory that like I kind of like that lives in my mind about how, you know, you hear the saying of like, oh, like growth exists outside of your comfort zone. So I think that, like, you know, like as cliche as that is too, I mean, there is with like your understanding your own emotional capacity, but I think when it comes to like whether your internal self growth or like when you're doing community work, like when it's uncomfortable but comes out of a place of love, I feel like that's a place of like, oh, like this, what I'm doing is impactful. I say that's like an affirmation to you.
Oh, that's good. Yeah, like change, especially when you're trying to change like structural issues. Change doesn't come from just like sitting there and like, you know, being with the status quo. It comes from being uncomfortable and making other people uncomfortable sometimes. And so sometimes, you know, backlash or things like that, that's just part of it. I mean, even when I did #Magandang Morenix, there's so many Filipinos in the Philippines that are like, colorism doesn't exist here. And I'm like, sister, here's a skin whitening ad that is telling you that you'd be prettier if you were whiter. Like you can't just say that it doesn't exist. You know what I mean? So, you know, it's just every time you try to change something, there's always going to be someone that is, you know, there's some sort of aversion to a status quo. It's just always going to happen. But yeah, it's good work though.
Man. So this year background, I've also been reading a lot of like self like help and like growth books, like for like I don't know if you read like the four agreements and stuff. That's one of the big,
Yes,
like,
yes,
social-
love that one.
Yes, how it talks about like how um when people speak back, it's not a reflection of like you, it's a reflection of them,
Mhm.
you know. And I think that's like when I read that, I was like, oh, that's profound. It's like it's not me. It's
Yeah,
yeah.
sometimes you have to remind yourself. It's like, this person that is talking to you has probably grown up in completely different culture than you. Maybe they have a totally different socioeconomic background. Like there's just so many things that have molded them to who they are, that shaped their opinion about what they're speaking about. And sometimes it's just not about you at all. It's like sometimes I read a tweet or I read a comment and I'm like, this has nothing to do with me. You know what I mean? And
Yeah.
so so it's just like really great to hear that from you guys. It's good to know that I'm not alone when doing this type of work. It's good to know that I don't the way that I feel is validated, I guess is what I'm trying to say. So that's why I think it's really important to connect with you guys, to connect with community, because you don't feel alone. Yes.
Yes.
Green
Yes.
hearts. Yes.
Oh,
This
fun.
is totally nothing to do with what we're talking about. But have you watched Squid Game on Netflix?
No, everyone's been talking about it though.
Yeah, everyone.
Yeah.
I haven't started it yet, but there's like so many people talking about it. I'm like, I gotta watch it, I've been bullied into watching it, so I'm gonna start it today.
Same.
Oh,
Actually, I thought about starting it today. I saw like a few like TikToks about it. I'm like, all right, today's the day.
yeah, I
Okay,
guess
we're
that's
gonna
what
watch.
doing.
Yeah, we're gonna watch it today. We're gonna start a group chat on Instagram and we're gonna talk about it. That's what we're gonna do today, folks. Okay.
Go, yes.
Like Sunday.
But oh man, yeah, the hour did fly by. We're kind of close to wrapping things up, but I know we kind of deviated largely from how we initially thought we were entering this conversation. I hope it honored your experiences and like but just wanted to see did you have any main takeaways from this episode?
Yeah, I think one of my biggest takeaways is the love work. I love that so much. I'm definitely going to remember that. I think another takeaway is, that we should focus on racism, not race. I think that there's a lot of socioeconomic disparities within different ethnic groups that changes the data. It's not really about race, it's about racism. And I'm sure there's another one, but I can't think of it right now. But those are two that came at top of mind.
We're watching Squid Games today.
Yes, that's number three. That's number three.
All right. So I guess just to outro, I don't know if anyone here on the chat has any questions, wanted to give you another opportunity in terms of community, but just wanted to plug for mid-October, we still have more episodes coming out for PSST podcast. And so we have episode 12, Recovery in All Forms, aka any creative responses, something different than what we see, than just getting vaccinated, washing your hands, etc. But yeah, follow us on social media at PhilXAO_Cha and like us on Facebook. If you're watching us on Facebook, I'm glad. Hi, Mom. And thank you again to Apacho and We Can Do This, Department of Health and Human Services. And I know we had talked about it, but can we get any song baksak to close us out here? Arvin, do you want to explain a song baksak? Do you want me to explain a song baksak?
I can explain it. For those who don't know, it comes from there's two historical points where this is like a symbolic gesture of like movement work. So one is with the United Farmers Workers, UFW of Larry Leong and Cesar Chavez. At the end of the day, they did a single clap. It's still within their organization too. It's called the Unity Clap, but Isang Baksak was kind of like symbolize one rise, one fall. So in that movement, the labor movement too, that was kind of like a thing that unified all the folks there. And then also with like the people power movement in the Philippines too. So kind of it's symbolic now as like a thing to, you know, end our community events as well, as a, you know, homage to the past work that has been done and for the future work that's going to be done, and as well as ending today now as we continue forth and continue a legacy, long legacy of activism. Yes.
Okay.
So we're gonna do. I don't know how you want to do this too, because I've also done it multiple times, like different ways. We could do like a single clap at the end of baksak. So I'm gonna say isang, and then baksak, and then clap.
Okay. Hopefully there's no lag. I believe in us.
I know.
I believe in us.
Yeah, I know, we're on
Wheelchair
Zoom
connection, you know.
Okay. Isang bagsak.
Close enough.
So.
All right. Well, that ends this episode. Thank you again, Asia, Arvin. You know, this was amazing conversation. Really felt so comfortable and like friends here. Yeah, this is love work. I'm glad we're in this together. So thank you again. Thanks to folks who are on this call. Appreciate you. And we'll close out.
Yeah.